I'm an orthopedic surgeon. I practiced for over 35 years, was chief of sports medicine at Emory University, chief of orthopedics at the Atlanta VA/AMC. And I'm here to give you the full story on motion loss secondary to joint stiffness. Motion loss secondary to joint stiffness is the number one complication in orthopedics, causing delay in your recovery. What is motion loss due to joint stiffness? It is the postoperative or post-injury scar tissue in and around the joint that limits your range of motion. Scar tissue is the result of bleeding in and around the joint. This bleeding causes overproduction of fibroblasts and extracellular proteins such as tensin C. These extracellular proteins are like glue in the soft tissue that hold the collagen fibers produced by the fibroblasts together. Treatment for motion loss due to joint stiffness begins with managing the issues in the extra-articular tissues around the joint. Fluid can collect in these tissues around the joint called edema. Edema can be managed using compression dressings or bandages which help move the fluid away from around the joint. The second step in the treatment of motion loss due to joint stiffness is managing issues that are inside the joint or in the interarticular space. Commonly, fluid can collect inside of the joint, which will restrict your range of motion. This fluid is called an effusion. Your surgeon should look for causes of the effusion and help you manage this problem. The final and main treatment for motion loss due to joint stiffness is to stretch the joint. This process involves moving the joint along its normal lines of motion with a slow and determined effort to elongate the scar tissue, restricting your range of motion. Your physical therapist will help you understand the motions in which you need to stretch and train you on the stretching process. Your physical therapist will take the time to teach the stretches that you need to know in the directions that your joint needs to go. Now, there are several concepts that you need to understand about stretching. 1. Scar tissue is viscoelastic. It's like silly putty. When you stretch it slowly, it elongates. When you stretch it quickly, it breaks or tears. When it tears, scar tissue bleeds again, creates more scar tissue. The objective is to stretch slow enough so that it doesn't tear and doesn't rebleed. The human body is subject to stretchability. That is the ability to stretch without causing inflammation, injury, swelling, or edema to your extremity. Think about the stretch itself. It has a duration, which is the length of time you do a stretch. It has a frequency, that is the number of times that you do a stretch in a day or a week. And it has an intensity, that's how hard you do the stretch. Duration, frequency, and intensity form like a three-dimensional space, as you see on the screen. Inside this space, you're safe. You can't injure yourself. You don't injure yourself. You don't create more inflammation, swelling, or edema. The minute you go outside of that space, that is to say, you do something too intensely or for too long or too frequently, you start to re-injure yourself, creating inflammation, bleeding, swelling, effusion, and edema. The object of stretchability is to stay within this safe zone. If you can, you'll be able to stretch efficiently. Now, if you can get to the edge of your safe zone, you can stretch yourself more optimally. What do I mean by that? If you get to the edge of your safe zone, you get to the right amount of intensity, duration, and frequency that gives you the perfect stretch. If it's too inside the safe zone, you're not stretching yourself enough. The key to accelerating your range of motion is the concept of total end range time, or TERT. The more time you spend at the edge of your safe zone, stretching and elongating the tissues around your knee, the quicker you'll recover your motion. In the knee, we've shown that this takes 42 hours of stretching. And typically the human body can't stretch more than an hour a day. So this means that with an hour a day of stretching, you should be able to get your motion most of the time in 6 weeks on average. Some people more, some people faster. Now the hour a day doesn't mean an hour at a time, because that's a duration issue. You need to allow that knee or shoulder or wrist to rest. So you need to pace yourself out during the day, 5 minutes, 12 times a day, 10 minutes, 6 times a day. You're going to learn about your body and how you can tolerate the stretching process. The more frequently you do it during the day, with the less duration and less intensity, might be your best optimal way of getting to the edge of your safe zone and allowing the motion to return to your joint. Key to this is the last concept. Stretch to your discomfort, not to pain. If you feel an uncomfortable stretch, then perhaps you're at the edge of your safe zone. If you feel pain, then you might be tearing things. It's good to go slow and find and creep up on the edge of your safe zone. You wouldn't run to the edge of the Grand Canyon. You'd carefully walk to the edge. And that's the concept you need to do for your stretching program. Now, there are many techniques that a physical therapist can use to stretch your joint. Proprioceptive neuromuscular facilitation, static progressive stretch, a serial static progressive stretch, static stretching, dynamic stretching. Some of these you can do at home. Some of them that need to be done in the clinic. If you're finding it difficult to stretch your joint at home, you may be in need of a tool called a home mechanical therapy tool or device to help you stretch at home. Your physical therapist will help you choose the best device for you. If you want to recover from your joint stiffness, you need to spend the time stretching your joint to recover your motion. I wish it were different, but I'm here to tell you, after 35 years of practicing orthopedic surgery, you just need to spend the time. Thank you for listening.